Today, as you've heard, we're taking unprecedented actions, and I want to fully recognize the disruption that these changes will cause in people's lives. We don't take these decisions lightly, but we're facing an unprecedented health emergency. Individuals, communities, and businesses, along with healthcare organizations, must all act together to protect our community. Everyone's participation is critical if we will be successful. Why are we doing this now? As you've heard, we recognize increasing spread of COVID-19 in our community. And as we bring on more testing, we're learning of more cases each day. The number of cases doubles every several days. And we've had multiple instances of COVID-19 in long-term care facilities where vulnerable persons reside. We expect a large-scale outbreak in weeks, and this will be a very difficult time. It's similar to what you might think of as an infectious disease equivalent of a major earthquake that's going to shake us for weeks and weeks. I want to, at this time, express my condolences to the families and loved ones of those who have been affected by this disease and who have passed at this time. I know this is going to continue to be a very difficult time for all of us going forward. The social distancing measures that you've heard about this morning are intended to slow the spread of the epidemic, although we know we cannot stop it. By delaying the number of persons who become infected and reducing the size of the epidemic peak, we'll be able to have lesser impact on our community and our healthcare system. And although most of us will have mild illness or moderate illness that does not require medical attention, there are many older adults and there are many community members with underlying medical conditions that place them at higher risk for serious infection that will require medical care and hospitalization. Evidence from past outbreaks and recent COVID-19 outbreaks in other countries strongly suggests that early, comprehensive, sustained social distancing measures are needed to minimize the number of infected people and the number of serious infections among older adults and people with underlying medical conditions that increase their risk. We all must help to make sure our healthcare system can provide the medical care to those who will need it by minimizing the number of people who become ill and the number who become seriously ill. But regardless of what we do, the healthcare system will be very stressed. The actions we take now can lessen the pressure on the system so that more people who require hospital care can receive it when they need it. We all have people in our lives who are at high risk for severe illness from this virus. We all have a lot at stake. By taking steps now and acting together, we're not only reducing our personal risk of exposure and transmitting this disease, but we are reducing the risk of severe illness for those who are most vulnerable in our community. We know that the actions that we're recommending will create hardships, and we need to do everything we can to support one another. This outbreak will go on for weeks and likely for months. I appreciate that our policymakers and nonprofit partners who are working now to make all people able to provide. I appreciate that our policymakers and nonprofit partners are working now to support all people to be able to comply with the steps that we are recommending. As Executive Constantine mentioned, I'm issuing a health officer order this morning making other important recommendations to our community. Consistent with Governor Inslee's order, all events of more than 250 people are prohibited, and my order also prohibits, in addition, events with fewer than 250 attendees unless event organizers can take steps to minimize the risk to participants. This order is not intended for grocery or other retail establishments or for family events. I want to say just a word about schools. I want to reemphasize that school districts should prepare now if schools were requested to close in the near future for weeks to months, and be sure to develop plans to continue to provide necessary services such as medical and nutritional services to those students who need them if schools should close, and to provide a place for students if they have nowhere else to go. All of our school districts, city and county governments should think about the unintended consequences of our actions and plan to support our community. We'll be making additional recommendations for schools, workplaces, and businesses, and community-based organizations for individuals and families, and reinforcing that guidance that we have already issued today and in the future. I encourage all of those groups to look at the new, recently released guidance from the U.S. Centers for Disease Control and Prevention on Community Mitigation that went up yesterday afternoon, and begin to think about how they can take those steps that are described.